Welcome to Talk Dizzy to Me, the show that brings you a comprehensive look into the complex field of dizziness. Now here are your hosts, vestibular physical therapist Dr. Abby Ross and Dr. Danielle Tolman.
Welcome back, everyone, to Talk Dizzy to Me. My name is Abby Ross. I'm a vestibular physical therapist and neuroclinical specialist, joined always by Dr. Danny Tolman, also a vestibular physical therapist. And today we have Dr. Amir Kheradmand joining us from Johns Hopkins. And Dr. Kheradmand, first of all, thank you for joining us. And second of all, please tell our audience a little bit about yourself.
Well, thank you, and it's a pleasure to be here. I'm a clinician scientist. I am interested in eye movements and spatial orientation and how the brain functions related to both of these important areas. So anything related to these makes me really excited.
Then you're just like us, vestibuloholics.
Right.
Well, and that's why you're on the show.
Indeed.
So well, today, go ahead.
Well, I got really interested in eye movements when I was training in neurology. And I became really fascinated that the eye movements are intricately involved in many sensory, motor, and cognitive functions, from like sleep physiology to decision makings. And more importantly, they are directly controlled by the brain. And there are many parameters that are quantifiable when it comes to eye movements, like timing, accuracy of the movements, the velocity of the movements. And plus, they can be all studied through modeling and computational approaches that can help understand the brain function better. So that was the fascinating aspect of the eye movement for me, and how it can be a window to understand brain function.
Especially to quantify what is going on with our patients. You know, dizziness is very subjective and very difficult to measure. So being able to look at eye movements such as nystagmus is a huge help to us when it comes to working with our patients.
Exactly. And once you focus on eye movements, you'll learn that it is very important to understand the close connection with the ear balance function. So in a way, it's important to know what the ears are sensing to know how the eyes are moving, which is fascinating.
Absolutely. I always tell my patients when they say, you know, why are you looking at my eyes so much? Or they're wondering why we're looking at their eyes. Well, this is a window into everything else, a window into your soul, if you will. So today's topic is all about spatial orientation, or in our world, sometimes disorientation. Let's jump into the topic by discussing the multisensory aspect of spatial orientation.
Right, and it is directly related to the eye movements. And before we get to that, I think it's important to mention that it is very satisfying that using eye movements, we can really pinpoint lesions and understand problems inside the brain, sometimes even better than MRI. Like, for example, when it comes to the brain stem lesions, or eye movements are very important in treatment options, like how we track recovery across many brain conditions. For example, the BPPV, there's no other treatment in medicine that you can drive by looking at the eye movements with almost 100% efficacy and immediate positive outcomes. Not those, complicated surgical invasive interventions, just a simple maneuver that can be done to treat BPPV. And as we know, unfortunately, it's not well known or performed among medical practitioners. So these are the fascinating aspects of the eye movement that is also linked with brain function, and also related to more higher order functions like perceptual, cognitive, and motor functions that are controlled by brain and can be studied under the umbrella of spatial orientation.
We can see some of those higher functions present themselves in vestibular dysfunction, such as brain fog and difficulty with cognitive tasks.
Right, right. I that's fascinating. What the brain has actually do when it gets the signals from the ears, and how it has to incorporate that to control eye movements, and also integrate this information into other brain functions. So in a way, the ears are the organs that sense the gravity and let the brain get acclimated to that and integrate it into all functions. And this is something that we all take for granted. We're not really aware of it until something goes awry, like the fogginess happens. So, in a way, vestibular system uh, can help the brain sense the gravity and integrate it into many different functions, or fine tune motor functions, or control balance or eye movements, which is a very important uh, function if you think about it. Uh, and and there are many examples that can show the importance of that. Like, for example, when we go into situations that the gravity changes, like when we are flying, we can sense how important it is when our brain is struggling through situations that there is a sudden change in gravity. Like, a simple example is when we feel the turbulence on a plane, or a simple thing when the plane is taking off, and um, we're looking at the floor of the plane, and if you look at it looks like tilted to us, even though the orientation of the floor relative to our seat and us has not changed. So these are the important things that shows that our brain senses gravity through our vestibular system and incorporates that to various functions that it has to perform every day.
I like an elevator example too. Sometimes you can't use your vision necessarily to see that you're moving, but your body can still sense that you're moving.
Exactly. Um, it is in many ways, um, our vestibular system is important to detect our motion uh, and integrate that information into how it has to fine tune all other functions, and that's become very important to be able to control our actions, the multi-sensory aspect of the spatial orientation. Like, mm, each different sense give us a different perspective of the world, or to put it into different words, each of our senses have a different frame of reference. Like, for example, our vision depends on the angle and the position of our eyes in our head, and our vestibular system is like an accelerometer that can detect the motion of our head um, in different planes, or proprioceptive inputs from our joints can tell the movement and position of different parts of our body. So these sensory inputs encode different pieces of information, but they all need to come together at some point and generate a unified, coherent, consistent sense of surrounding, which we call spatial orientation. And that's a very important function that our brain has to do, mainly at the subconscious level. But it is very important to be able to take any other actions or interact with the environment. So our brain does it, but we're not really actively aware of it until something goes wrong.
So, what are some things that can go wrong within this, multisensory system that creates an issue with our spatial orientation?
Yeah, so uh, let's let's look at a very simple example that, again, we may take for granted. Like, when we walk from a well lit area into a dark room, we may not notice that our brain is smoothly switching sensory processing, and update its precedence for relying on particular sensory signal like the vestibular inputs, but the end product, which is our sense of spatial orientation and balance, does not get disrupted as a result of that. Or go ahead.
No, keep going.
I kind of like this example. It makes it more tangible to feel how valuable this function that the brain does. Like, you can think of our smartphones, which these days they all have a camera in them. If we record a video with our smartphone and tilt the phone while we're recording and then play back the video, we can see that the image recorded is moving in the opposite direction of the phone while it was moving. So if we do that when we're looking at the same scene and tilt our head, the world stays steady, because the accelerometers in our head, which is our vestibular system, can sense and adjust the position of the eyes and also help integrate the information with other senses to keep the world steady in front of our eyes, something that the accelerometers in the phones do not necessarily do, which is, again, very fascinating. So anything that goes wrong in this process can cause a spatial disorientation. It's like when you see a cursor on the screen frozen. The problem could be the mouse, could be the screen, or the operating system, or the CPU of the computer. And it's sort of the same when it comes to spatial disorientation. The problem could be the vestibular system. It could be how this information is integrated to maintain spatial orientation, or it could be how it is used to control the eye movement. So anything that goes wrong in this process can make someone disoriented.
So one thing, it sounds like in some ways we are still smarter than our phones. This is great. But also, there are certain situations, something you said reminded me of this. There are certain situations where our sensory inputs are not exactly matched. So we want we want all these inputs to bring us to the same conclusion, right? We're moving to the right, or we're still, or whatever it is. But what happens if our sensory inputs are not exactly interpreting the same thing?
Well, that could be also the source of mismatch and spatial disorientation, and it is actually a very important process that has to take place inside the brain to make sure that the information is updated according to what is available and integrated to maintain a unified spatial orientation. So in situations that there is a disruption in that, or that there is a mismatch, it can create a discomfort, something that could be interpreted as dizziness or fogginess. Again, these are situations that one sensory input is telling the brain one thing, and another sensory input is telling the brain another thing. So the end result would be very disruptive.
Uncomfortable. My husband experiences a lot of spatial disorientation every time we go to Universal and ride the rides over there. He does not do well with all these new rides that require 3D goggles. They put you in some moving machine that's not actually moving, but it's tossing you all around and giving you a full field optokinetic, image of something moving, like a roller coaster, or something along those lines. So what are some of those symptoms that somebody might experience? Like we see, I think, very commonly, a hot flash or sweating, some nausea, some feeling nauseated, dizziness. Is there anything else people might experience?
So symptoms of spatial disorientation could be within a range of dizziness, vertigo, and be linked with the other things that the vestibular system controls, like the autonomic dysfunction. So anything that goes wrong within the pathway of vestibular inputs to the higher brain regions can cause the symptoms that can range from dizziness to spatial to vertigo. So the way you can think of it is like dizziness is a sense of disrupted spatial orientation, and vertigo is the false sensation of motion. So all of these can fit into the category of perceptual central or peripheral problems that can be caused by vestibular dysfunctions.
Now, we talked about some of the symptoms that a patient might describe, but when you're listening to a patient's history, are there any particular clues besides their symptoms? Because there's a lot of things that can cause all of those symptoms, right? What else are you listening for that may clue you into the fact that this person is having some spatial disorientation?
Well, this is very challenging because, as we know, people may use different terms to describe their symptoms, and often what is described does not really exactly show the source of the problem. And that's why it's important to have objective ways to measure spatial orientation. And that brings us to something that's been lacking for a long time in our field, and that's having ways to be able to objectively measure spatial orientation. But because subjective ways, as we know, can't really uh, tell us about what's exactly going on inside the brain. As we know, the quality of the symptoms are not really reliable as described by patients because it is a subconscious process and it's really hard to put it into words to describe it. So that's why it is important to be able to measure it objectively. And a major gap has been to apply what we know from almost a century of research to the clinical understanding of these problems like dizziness and vertigo and spatial disorientation. There are many methods, and I can give you one example through a field that is known as psychophysics to be able to measure spatial orientation. So one simple way is to use gravity, which is a frame of, is a very good frame of reference to be able to measure spatial orientation. So a simple task of asking someone to tell you which way is up. So even if we don't use our vision, our brain through sense of gravity and vestibular system is doing a great job in understanding which way is up. The errors are within plus minus 2 degrees of true vertical. And when the head and body are tilted, there are changes in these errors in a systematic fashion that we understand through research, and we can compare these normal patterns to patients and be able to understand how certain disorders can really affect the spatial orientation. And this is where hopefully the future can bring us to be able to have objective ways to measure spatial orientation, dizziness. So if someone tells you they're dizzy, you can apply these methods to measure their related brain functions.
Is there anything coming out soon that might be able to do this objectively?
Well, we already have some of these methods that through technologies are becoming more available. They're used in clinics, but I think we still need more work to do to understand their relevance to dizziness and different conditions that can cause it. So we're hopeful that these methods can become more incorporated into the daily clinical practice and be used for diagnostic purposes.
Would one test be potentially the subjective visual vertigo test or vertical test, where we use kind
Right.
of the bucket to figure out if the patient can tell us which way is up?
Exactly. And like there are now computer, phone-based programs that can be used to measure subjective visual vertical. There are also other tests, like for example, one can measure perception of head tilt position. One can measure uh, uh, perception of upright using a haptic method. So putting all these different tests together, it would really help understand how an individual uh, can sense uh, gravity, how it's incorporated to their spatial orientation, and whether there are abnormal patterns uh, in that or not.
So more technology on the way to be able to better objectively assess this within the
Eh,
clinic.
Yeah, because history is very important, but when it comes to dizziness, relying on the subjective quality of symptoms, it can just only make the medical practitioners dizzy themselves. So it's just so hard to understand what the patients are trying to convey, and it's because it's not something that we know or understand until we experience it. So it's very hard. So the only way to be able to get into that is to use um, methods that have been developed to measure perception and apply it in a practical way in the clinic.
So, what are some of the diagnoses that are related to issues with spatial orientation?
So spatial orientation is a fundamental function of the brain. So anything that can affect sensing body position and the environment and putting this information together can affect it and cause it. So from BPPV to stroke to perceptual dysfunctions like vestibular migraine, they can all cause spatial disorientation. So in a way, it's an umbrella term that can have dizziness, vertigo, and many other things that we hear from patients with vestibular disorders included in it.
I think, Abby, you and I see this a lot in practice with vestibular migraine, triple PD, some of the more chronic conditions where patients have been suffering for a long time. They might be over the acute room spinning vertigo sensation, but they might have this dissociation from self, floating, light feeling that really is functional, but really messes with their quality of life from a day-to-day point of view because of that mismatch in sensory output or input.
Right, exactly. So, um, and I just want to go back to the example I gave you earlier. It's like we can think of the problem as when uh, our cursor on the screen is frozen. So we can think of it as a spatial disorientation. But the problem could be the mouse not working, which, for example, could be the vestibular system, or the problem could be the operating system or the CPU of the computer not integrating the mouse information with the rest of the functions. So in a way, anything within the system that can go wrong can cause a spatial disorientation. So vestibular system is one aspect of it, but this information need to get inside the brain, and they need to also be integrated with other sensory functions. So if something else goes wrong with the sensory information, like for example, people who have visual problems, they can also get dizziness. So it's not always vestibular system that can be the source of dizziness, and problems inside the brain can also lead to that. So we're talking about the range here. One range could be, at what end of the range could be dizziness with head movements, and The other end of the range could be a total spatial neglect as a result of a stroke that affects uh, cortical brain regions. So it is overall a multisensory process.
Now, certainly it will depend on the cause of the spatial disorientation, but what avenues for treatment? How do we help people with these types of issues?
Right. So it becomes again important to identify the cause. So the key would be making the diagnosis, because if someone is disoriented because they have underlying BPPV, this could be simply taken care of by treating the BPPV. So identifying the cause and source of the problem would be the key for treatment. Um, also, it's all important to understand how the brain functions when it comes to spatial orientation, to get a better idea about the source of dizziness in many patients with perceptual dysfunctions. And I'm talking about patients with, for example, vestibular migraine. So if, if we think about it, spatial orientation is like many other skills for the brain. There are people and folks who are really good in certain things, like, for example, in spatial navigation or spatial orientation, uh, like dancers. They can do all the complicated um, uh, maneuvers and getting in and out of different positions without getting dizzy at one end, and at the other end we have people with vestibular migraine that can get dizzy with even simple head movement. So not everybody is the same, and there could be ways to help people tap into their brain capacities to to uh, become more comfortable with their spatial orientation, and become more comfortable with the daily activities, especially when they are affected by dizziness. And that's why when we get to this field, it becomes very important to apply techniques like physical therapy or rehabilitation, because this is like um, a muscle that is weak. If you think of the spatial orientation, you need to work it out and make it stronger. So it's important to get exposed to proper uh, uh, techniques to help the brain train itself and become better in spatial orientation. So again, shows the value of physical therapy and rehabilitation in treating conditions like that.
So with treatment, what's the prognosis look like for a patient suffering from spatial disorientation? We know that it's really important to figure out what's causing the disorientation, whether it's from stroke or vestibular dysfunction or something more centrally, focused. But what does the prognosis look like for somebody? Is there hope? Is there the chance that they'll be able to get better from this with therapy, with the right treatments?
The good news is that the prognosis is really good. So many dysfunctions that can cause dizziness, especially those like vestibular migraine or triple PD that have perceptual dysfunctions as part of their mechanisms, they are the ones that can really get better. But the real challenge is that getting to the point that patients become more comfortable with their symptoms is hard, because the dizziness is affecting a fundamental function, the spatial orientation. And if you are disoriented, it's really hard to do anything else. But once the patients pass that stage and be able to tolerate the symptoms better, the prognosis is really good. So overall, among disorders that can cause a spatial disorientation, things like vestibular migraine or triple PD have a really better prognosis compared to other things like stroke that can cause a spatial disorientation.
Now, I will say too, I think it's important to note that in rehab, kind of like that muscle that you were explaining that needs to be trained and needs to be worked again. In doing so, you may experience symptoms. In fact, we kind of want you to experience symptoms so that over time, with practice, with repetition, those symptoms become less and less.
Exactly. So it is true the exposure to that kind of error that the brain learns how to deal with it. And that's exactly what, for example, dancers do. You know, they're not born that way to do those complicated things. They train their brain. So it's sort of like the same approach. So patients with perceptual dizziness, they don't need to become dancers, but through dancing and activities that can help train their spatial orientation, they can tap into that brain capacity to recover and feel more comfortable with their daily functions.
Now, to those clinicians listening, we do want to make our patients dizzy, but within a therapeutic level, could you talk to this aspect of pushing it too hard? Like in this field, there is certainly, it's not no pain, no gain. We can definitely push somebody past their threshold by doing too much too soon. What happens in the brain that creates this issue? Like, why can't we just push a patient, harder, harder, harder to get them better faster? What happens?
Yeah, that's a good question. So I think it's a balancing act. It's important to make sure that you do not overwhelm the system with something that it can't handle yet. So that's why it's important to apply it in a stepwise fashion. And people are different, and there are people who can tolerate it better cognitively and physically, and there are people who really need um, more dosing of what they do. So I think it also depends on the individuals too.
It also reminds me of Simone Biles in the Olympics this year, how all those twists and turns, she was feeling extreme spatial disorientation, probably caused a lot of stress and anxiety for her, but also recovering from it, right? It's possible. There is hope there. Is there anything else that you'd like to share with our audience? Anything we missed covering this topic? Anything you'd like to share about yourself?
Oh, I have to say that this is a field that needs more work for sure. We know a lot about the vestibular system. We really know about how it's connected with the ears, how the uh, inputs from the ears control our eyes, but we haven't really paid attention to how the vestibular system is integrated with other brain functions. And I think that's the key to understand disorders like vestibular migraine and triple PD. And the majority of our patients these days have these disorders. So I think it's about time to start looking into those areas and brain functions that can help us understand these disorders better. In a way, in our, well, you can think of it this way, in our modern life, we do things that can, really challenge our brain when it comes to spatial orientation. So we sit in front of computers and look at screens for hours, do multitasking while looking at the screens. Even if we want to work out, we get on treadmills and platforms that don't actually uh, take us anywhere, or put on virtual goggles and get on stationary bikes. So not everyone's brain can really handle this kind of illusory environments the same. And our brains have not evolved to be able to handle these unnatural environment. So it's not surprising that we hear a lot about how technology can make people dizzy, and cause a spatial disorientation. Necessarily not a bad thing, but it is something that we have to be aware of it, and we really need to understand it better. So definitely more work that needs to be done in this area.
Is there anything in terms of research that you're participating in this area currently, or that you have participated in the past?
Right. We have done work in understanding spatial orientation. So some of our earlier work, we used magnetic stimulation to understand the cortical function and how how it's involved in sensory integration for spatial orientation. So. I really think that understanding those kind of functions would be the key to understand perceptual sources of dizziness better. We've also done some work in measurement of vestibular ocular functions, the otolith functions related to torsional eye positions. So that's also a work I think would be valuable to better understand the control of the eyes, the role of otolith in various brain functions. So there are many areas. If you think about the vestibular world, there are many areas that need to be studied more. So very exciting.
That is, I think some of the research that still blows my mind is looking at spatial orientation in anti-gravity situations. Like how do we perceive this where there is no gravity that affects our vestibular system? I think the work in that is just mind-blowing. It's such a hard concept to wrap your head around.
It's amazing. And that again brings us back to the point about sensing gravity and how much we are unaware of it, as our brain is doing a perfect job in that. So astronauts, they always explain the type of illusions, which is mind-boggling. Like, for example, when they are in space, they describe all different kinds of illusions. Like, they mix up the walls, ceilings, and panels of the spacecraft, and they have to sometimes go through intense training to be able to keep things steady in front of the eyes. And that shows the importance of gravity in how it stabilizes our perception of the world, and something that we're not really aware of it. And that's not only through the vestibular system, it's through how the vestibular system is integrated with different functions like proprioception, like vision, like other like somatosensory functions. So it's a fascinating thing. So if you think about it, vestibular function is a multimodal function from the get-go. So that's why it is integrated in everything that the brain does, and it's a fundamental function that has to be there in order to do other things or do any kind of multitasking.
I think that sums it up right there, right? Vestibular system is a multimodal function, and it's so important in our everyday function. And also, which was echoed throughout today's talk, until something goes wrong with this, it's not something we think about until something goes wrong. And therefore, it's really hard to understand patients or loved ones or coworkers who do experience these types of symptoms. Thank you so much for joining us today, Dr. Kheradmand. We look forward to working with you in the future and seeing what more is coming in the field from your end of things. And you know where to find us, audience. Thank you for tuning in today. We'll see you next time.
Thank you.
Oh, thank you very much. It was a pleasure.
If you're interested in finding us on social media or the web, you can visit www.vestibular.today for more resources, including testing, treatment, and educational videos, blogs, continuing education classes, and resources including clinic equipment recommendations, suggested tests, and BPPV treatment charts.
Search Vestibular Today and Balancing Act Rehab on all social media platforms, including Facebook, Instagram, Twitter, and YouTube. Also, be sure to check out Balancing Act Rehab at www.balancingactrehab.com, especially if you think you would benefit from vestibular therapy. We are your girls. The information on this podcast is not intended to replace the care provided by your qualified health professional or to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on Talk Dizzy to Me. Please contact us at Balancing Act Rehab if you think you could benefit from vestibular therapy.